I feel strongly for the children of Pakistan. They are still suffering with a lack of resources countrywide.
मतलब ये इल्म नहीं था कि इसका कुछ सही हो सकेगा। जहाँ ले जाती थी वो फौरन मुंह फेर के जवाब दे देते थे, बच्चे को कहीं और ले जाए, बच्चे का यहाँ इलाज नहीं।
वहाँ से हमारे को उन्होंने इधर भेजा। उन लोगों ने बोला हम बच्चे का ऑपरेशन नहीं करते। उन्होंने अल्ट्रासाउंड भी किया, सब कुछ किया इनका।
This patient is coming from Quetta today. Okay, we are attracting patients from all over country. The reason why he became so cushingoid also was that there were inappropriate doses given for inappropriate duration. These doses are very much well studied now, and they're very specific things that you have to look for, and well tried things, which unfortunately is not practiced so commonly in the periphery.
These children have been neglected, missed. They were missed because the facilities were not there. There was no mass education. There were no basic screening of the children when they were born. Otherwise, this would have not happened. So this catastrophe is actually magnifying our failure.
So there's a huge backlog, if you like, of children in Pakistan who have not been treated at all or have been treated poorly in the past, quite apart from the new populations who will be coming along in the coming years.
I am following about 2,500 nephrotic children. And in one OPD session, I see somewhere near 180 to 200 children.
So this number adds to the problem, and the stone disease adds. So there are huge number of patients who are suffering from urinary tract diseases.
पेशाब तो पैदाइशी इसका बहता रहता है, यानी कुछ समझ में नहीं आ रहा था इसकी, मतलब जो ब्लडर थे वो बिल्कुल अलग अलग हुए हुए थे, मतलब जो चीज़ थी लग ही नहीं रहा था कि ये बच्चा सही हो सकेगा।
बस फिर पेशाब 24 घंटे पेशाब उसका निकलता,
पेशाब कतई गिरता है
बार बार। उसको दाखिल कराते, इसको बच्चे मजाक करते थे, अरे मुत्तू मुत्तू, तो फिर जाता नहीं थी, और घर में बहनें पढ़ाती हैं, ये पढ़ता नहीं।
Well, the child, they are disturbed, they are in pain, their appetite is disturbed, their sleep is disturbed, and as you said, the most important thing is that the children are very much conscious of their social environment. It will be much more embarrassing for him if he is relieving himself on this file. So we have to make sure that nobody laughs, nobody tells anything, and they have to look after that.
Incontinence, that if you are wet and smelly, if you are incontinent of urine and incontinent of stool and have to wear a diaper, then you rapidly become isolated from your contemporaries. And I've seen many children in Pakistan in that situation quite late in childhood who've never been able to go to school because of their incontinence.
नहीं, अभी तो नहीं। स्कूल जाने दूसरे भाई बहन जाते हैं तो ये कहते हैं अम्मी हम कब जाएंगे। डॉक्टर बशीर से भी ये जिक्र किया, कह रहे हैं डॉक्टर साहब आप बुढ़े हो जाएंगे, मेरे इलाज नहीं करेंगे ना, फिर मैं कब पढ़े लिखा करूँ बुढ़ा होने के बाद।
There are certain diseases where they get more pain. Certain diseases they are not that painful as the disease itself, but they are leaking urine, they are soiling their clothes, they are stinking, they are social problems. They cannot go to school when they grow. Even their siblings, their family members, they don't allow them to sit or sleep with them. So there are major social issues.
हर वक्त सलवार गिल्ली, हर वक्त सलवार गिल्ली, बार-बार कपड़े आगे बदलना, बार-बार कपड़े आगे बदलना।
पढ़ने से इसलिए रह गया ना ये।
एक क्लास भी नहीं जा
पाता। वो आती थी किसी के बाद काम के बाद बैठाते थे हफ्ता, तो वो ले आए, वो आती उसके बाद से कपड़े के लिए से दिन में 2 दफा 3 दफा 4 दफा कपड़े बदली करते थे।
Certainly develops any form of phobia or inferiority complex about it, and certainly before his peers begin to make fun of him and isolate him in that way.
काम सीखने जाता था, 1-2 हफ्ते काम करता था, फिर छुट्टी।
बोले बदबू
आती थी, कोई रखता ही नहीं था।
Psychological implications. A child who is, for instance, with a incontinence of urine, he is in a very difficult and in a very unpleasant scenario because of being completely wet and unable to socialize and compared to his other mates.
जी हाँ, होता है बच्चे दूर भागते थे, कोई कोई खेलता था, कोई दूर भागता था.
Education is suffering. His height and weight will be suffering. We have to correct the same. Bladder has to be corrected now, and then he will be transplanted. Can you imagine the whole family has been destroyed? And it would have costed only few rupees to investigate these children. And so this one disease, there's so many diseases in children. The children are just dying at the age when they should not.
Children born with congenital malformations of the genitalia, where the psychological implications, particularly when they reach an age of pubertal development, can be quite devastating.
Abnormal appearance, and this largely refers to the genitalia, which of course in Pakistan is not necessarily an easy thing to discuss. It's not something you will want any other family to know, that your child has a genital abnormality, because of the great importance socially.